prostate is a male organ. It is found only in males. It is not found in females. It is a reproductive organ. It helps helps the male to form semen, which by helps in reproduction. So this is what prostate does. It is located below the urinary bladder, and from the prostate, the urethra passes, which carries the urine from the urinary bladder and the semen from the testes. So basically, the prostate is an organ situated below the bladder, surrounding the urethra. So prostate is important for the reproduction. Other than that, it is not of much value. What happens is after the age of 45, 50 years, all males, and by this, when I'm saying all males, the size of prostate starts increasing. It is like having graying of hair, having wrinkles as your age increasing. So it is an aging process. All males are bound to have their prostate increase after the age of 50 years. So everybody's prostate increases. However, during this process of increasing size of prostate, sometimes cancerous cells develop in the prostate, and that leads to prostate cancer. Main causes of prostate cancer, I'll say two main causes of prostate cancer. One is genetic history. If there is a family history of prostate cancer, always visit a doctor. Let him screen your prostate for if you are harboring any malignancy. Second is again cigarette smoking, tobacco use. They all increase the chances of prostate cancer. So signs and symptoms of prostate cancer appear very late. So again, the treatment of cancer is early detection. Whenever you become symptomatic for prostate cancer, probably we have missed the train. So it is important to understand that screening for prostate cancer is important. But nevertheless, let us discuss few signs and symptoms of prostate cancer. Prostate cancer symptoms can arise because of two reasons. One is the increase in the size of prostate, which is the localized symptoms. And second is the symptoms because of the spreading of prostate cancer to the rest of the body. So now let us discuss first the symptoms of prostate cancer occurring because of increase in the size of prostate. Increase in the size of prostate can lead to urinary symptoms. We call them LUTS, which is lower urinary tract symptoms. What are those? Frequency, going to pass urine again and again, not able to control the urine. Urine passes before you rush to the bathroom. You have to get up too many times in the night. You have to strain while passing urine. You have to apply pressure on your abdomen. The flow of the urine is poor. Many times you spoil your pants and your legs while passing urine because the urine is not able to go further ahead. You feel like you have not passed your urine completely. So all these are signs and symptoms of prostate gland increasing in size and compressing the urethra. Second symptoms can be because of bleeding in the prostate. The symptoms arising because of prostate cancer spreading to the rest of the body part. The most common thing is pain in the body. The prostate cancer typically spreads to the bones. So bony pain, pain in the spine, pain in the spinal canal, the spinal cord that we call, pain in the joints. So all these kind of symptoms of prostate cancer. So nowadays it is a routinely available test. We call it the PSA test, which is a prostate specific antigen. It is a blood test. It is recommended that after 50 years, everyone should get a PSA test done. It is a part of the health screening program, which is undertaken by many laboratories. So you should always get yourself a PSA test done. If there is a family history of prostate cancer, maybe at 45 years, you can get it done. But after 50, each and every male should be getting a PSA test done. If the PSA is normal, repeat the PSA test after 3 years. If the PSA is abnormal, you should visit a urologist. If you are diagnosed with prostate cancer and you say, no, we don't like doctors, I don't want to do anything, probably nothing is going to happen for the next 3 to 5 years. So prostate cancer is a very slow growing cancer. In fact, when patients come to us with a prostate cancer after the age of 80, 85, many times we tell them we don't need to do anything. You live your life. You'll probably die with prostate cancer rather than because of prostate cancer. So again, prostate cancer is a slow growing cancer. Now coming back onto the treatment part. So you have localized, it means the prostate cancer is confined to the prostate, and you have metastatic. It means the prostate cancer is already spread outside the prostate. Localized prostate, the best treatment is radical prostatectomy, in which we remove the entire prostate gland. How is it done? three methods. One is a conventional method, one is a laparoscopic method, one is a robotic prostatectomy. All three are good in spite of the information which is being available in the public domain, few saying this is better or that is better. All three give equally good efficacy: robotic, laparoscopic, or open surgery. The second available option for localized is radiation. Radiation slightly inferior in outcomes to the radical prostatectomy, which is the surgery. But yes, radiation is also an option. Now, when the prostate cancer spreads outside the prostate, it spreads into the body. The options available are hormonal treatments. In hormonal treatment, basically what we do is we stop the testosterone production of the prostate, the testosterone production in the body. Now, testosterone is a hormone which is found in males. It is like food to the prostate. If we stop giving food to the prostate, the growth of the prostate reduces. So how we do that? There is medical method in which we give hormonal treatment, injections to be taken once in 3 months. And then there is castration, in which the testosterone producing part of the testes is removed. So we stop the testosterone production and the growth of the prostate reduces. So the prostate which was going to grow in 10 years, now it will take 20 years to grow because we have stopped this food. Then there is chemotherapy available, radiation available. Nowadays, newer methods of nuclear medicine is also available. Preventing prostate cancer, rather than this question, the question should be how to detect prostate cancer early. Prevention, again, is not much in our hand except for stopping tobacco and smoking. You can't stop who your parents are. You can't stop who your cousins are. If they have suffered prostate cancer, if you are genetically prone, you are prone. There's nothing much that you can do. But what we can do 100% is detect the cancer early. You do PSA, there is a very high possibility that prostate cancer will be detected early, will be treated early, and you'll be 100% cured of prostate cancer if you have it.